The Republican governor of Arizona, Jan Brewer, has done a lot of really bad things as governor. One of the few good things that she has done that we can point to has been not to fall to right-wing pressure to resist the Medicaid expansion as part of the Affordable Care Act in her state, but to actually participate in the Medicaid expansion. And we now are starting to get data about the results of that expansion, and the data predictably show that hospitals have started to save money as a result of this Medicaid expansion that took place. The uncompensated care at hospitals has decreased, and this has been driven by low-income and uninsured people who can't pay for their hospital bills now being covered by Medicaid. After Arizona back in 2011 removed childless adults from the Medicaid program, the amount of uncompensated care absolutely skyrocketed. And if you know anything about basic logic and reason, just because a hospital bills someone for care, if they are uninsured, the odds that you will ever collect for having provided that care are obviously lower than for someone who has insurance. And after expanding Medicaid as part of the Affordable Care Act in the first 4 months of 2014, according to a new report that we have, the uncompensated care at Arizona hospitals dropped by 31% compared to the same period in 2013. This helped the average operating margin of Arizona hospitals increase from 4% to 5.2% over the last year. That's more than a 25% increase in the operating margin. This is just obvious. I mean, I know that there are still people who don't understand the logic and the math behind this and the rationale. But of course, if you bill people who have no insurance, your actual collections will be lower than if you have the Medicaid expansion. And of course, if you have to then pass along to collection agencies, if we know how the entire medical billing bureaucracy decreases profits, this is a no-brainer, Lewis, and we still have many states that are refusing to expand Medicaid.
Right. And part of it is just in opposition to the current administration.
Right.
And I'm sure Brewer probably did not want to do this, but of course realized that it was the smart thing to do. It would be good for her state. And she probably had some pressure from, medical professionals and organizations in her state.
Well, the medical professionals and people thinking clearly in Tennessee, Georgia, Virginia, North Carolina, they have not been successful. And many hospitals have actually been forced to close there. It amazes me that there are people in these red states who think the reason they can't get care is because of something President Obama did, as opposed to because their Republican governor is just not participating in the Obamacare programs.
Right. It's, I guess you could say the same thing about voting for these people in the first place. It's just uneducated citizens.
Well, that's exactly my question. How can you get people to vote for their own best interests when they don't even know who is responsible for what they're complaining about in their own states? It's very tough to convince someone to vote out their Republican governor when they don't realize their Republican governor is the cause of the problem.
Right. I guess they just need to stop watching Fox News and the and corporate media.